There's a new warning out by the Centers for Disease Control about pregnancy and alcohol. Those experts now suggest women even thinking about getting pregnant should stop drinking alcohol. So joining me now, Dr. Michele Petrucelli, an emergency medicine doctor at Hartford Hospital. Thanks so much for being here. We appreciate your time.
Thank you for having me.
So first off, some confusion out there in regard to this latest warning about pregnancy and drinking. Can you sort of break down the report findings to us?
Sure. So some of it is what we know and some of it is what we don't already know. For example, we already know that alcohol has negative consequences during each trimester of pregnancy. And we also know that most women don't realize that they're pregnant until they miss their first period, which is approximately 6 weeks into the pregnancy. What most people, or some people, don't realize is that during those first 6 weeks is when very important things are happening. The spinal cord is forming, the brain is forming, the heart is forming, all the organs are forming. So what this CDC report is saying is if you currently are trying to get pregnant and you stop using your birth control, then at the same time you should stop drinking any alcohol.
And when trying to get pregnant, is moderate drinking okay or no drinking at all? Where do you draw the line? Because there's a lot of different sort of wives' tales out there.
Absolutely. So what we know thus far is that alcohol in excess can have negative consequences. And we know, and this CDC report is showing, that no alcohol has positive consequences. What we don't know, and what they're not willing to say, is how much is just enough to have without having a negative consequence. So what they're recommending is if you're trying to get pregnant, if you stop using your birth control, then you shouldn't be drinking for the safety of the baby.
I mean, like you said before, in those first 6 weeks, it is absolutely fascinating what is going on inside a woman's body and the rapid progression of life. So we do know that the effects on a young fetus are pretty serious.
Absolutely. And so the concern also in the CDC report was about binge drinking, because if a woman is engaging in binge drinking, she might then engage in some behavior that can have negative consequences. For example, not using birth control, having sexual intercourse, that sort of thing. So most of those pregnancies, if you are binge drinking, they're showing that it can lead to unplanned pregnancy. And those unplanned pregnancies have a higher risk of having what they're calling fetal alcohol delayed syndrome. And so what they're recommending is, again, women of childbearing age, if you plan to have sex, then you should use birth control if you're drinking.
Fantastic information. We could talk about this so much more, but that's all the time we've got for today. We thank you for your insight and taking the time for us this afternoon.
Thank you for having me.
All right, Brent, back to you.